Just recently, the federal government launched the newly developed National Action Plan for Health Security, a 5-year strategic plan to reposition the nation's health system. Today on Sound Health, we are looking at the basics of this action plan. I'm Olasumbo. Welcome to the show. It's still Sound Health on Lagos Television, and I'm being joined by Ayo Adebusoye, the Secretary General, Nigerian Network of NGOs. He's going to give insights on the recently developed National Action Plan for Health Security by the federal government. Welcome to the show.
Thank you very much for having us.
Okay, being the fourth country in Africa to develop this plan, what's the need for Nigeria, the citizen, and is this the solution to Nigeria's health system and the emergency response system?
Thank you very much. In fact, one of the things we as a network are committed to, especially in our work with the Partnership for Advocacy in Child and Family Health, is to ensure that there's sustainable health financing in order for us to achieve our health outcomes. So the National Health Action Plan on Health Security is welcome as one of the key ingredients for ensuring improved well-being for the citizens. And Nigeria, the largest country in Africa, and of course, anything that happens in Nigeria has effects continentally. It's about time we actually take those steps to ensure that we as a nation are not dependent only on foreign development partners when it comes to emergencies. More and more, increasingly, we're seeing the increase in communicable diseases at a very, very advanced rate. We saw what happened in the last Ebola crisis. As a matter of fact, in DRC now, in Congo, there's actually one of the worst outbreaks of Ebola happening right there. And we know with the way the whole continent and the globe is interlinked, and Nigerians are so expert travelers that, like what happened last time with the soya incident coming here, we need to prevent that. These are the kind of things that we have to do in advance. Unfortunately, Lagos State has even gone a bit more than just the plan, action plan, and recently they launched their biobank. They've actually got Canadian support of the Canadian government, went forward to ensure that we actually begin to have things in place to ensure that we even now can start to develop our own vaccines. If we have to depend on the WHO abroad, it's not a sustainable model. So the action plan is a first step, but beyond that now we have to begin to make investments into ensuring that it happens. Because one thing is to have the plan, another thing is to implement.
Okay. Can you please take us through the basics of this plan? It's a 5-year strategic plan. Can you please take us through it?
Yes, I think the basic elements actually to ensure that we have in place in Nigeria structures in place, our health interventions that would ensure that communicable diseases can be contained, can be prevented, and can be contained at all levels of government. We should remember that we have a 3-tier level of government, local government, state, and the federal. And I think one of the important things which the plan seeks to address is to have that coordination where all the various tiers of government can work in sync to ensure that emergencies are prevented by having enough structures in place at all levels of health interventions, the tertiary institutions, the federal level institutions, the states, hospitals, general hospitals, and even at the PHCs. And as I said earlier, Lagos State has actually taken a step forward with its biobank, which is just had in Lagos State, which we just launched recently, and which we are hoping to see investments. Private sector investments are key to ensure that we actually achieve the objectives of the plan. It's not going to be something that will happen by itself. And so one of the factors that we're looking at is the aspect of investment, government investment in health. If we have an action plan which is trying to achieve health security for Nigerians, it's not going to happen without funding. And as we know, donor funding is shrinking. So we are looking at, for instance, the 2018-2019 budgets, both at the federal and all levels, state levels, to increase. But we have not seen much evidence so far of that. And those are some of our concerns.
Okay, looking at the action plan, if you take a closer look at it, it's going to go up about 134 billion for the next 5 years. And what do you think can be done to achieve success? And let's take that for instance. What can we do?
Now we have, if we're talking 135 billion, for instance, for that alone, if you look, that is just a subsection of the whole second national strategic health development plan, which is even talking about for a 5-year period up to 2022, we're talking about 4 trillion if the status quo remains. But we don't want the status quo to remain. We want to improve our health outcomes, because right now our health outcomes in Nigeria are one of the most appalling in the world. Our maternal mortality rates in 2013 was 576 federal, and we're looking at trying to scale up. Even if it's moderately, you're going to need an investment of about 6 trillion estimated in the plan. And if you want to really aggressively scale up with PHC revitalization and the rest, and of course the health security, we're talking about 7 trillion. Now, where is this money coming from? When for the last few years we've been having maybe about 300 billion for federal government spend, both recurrent and capital, annually. So it means that there's going to have to be a lot of investment from sources that we have not used before. First, from government. Thank God the Basic Healthcare Provision Fund has come up. We're talking about the 55 billion there. That's still the 1% consolidated revenue fund. Then we're looking at the various states, and that's where we're actually, because the states are actually where the health interventions are actually going to happen. It's not going to be just at Abuja. It doesn't work. The states are actually the ones that should lead, but so far they have not been leading. And therefore we're looking at a situation where there is radical increased spend from the state governments and federal. For instance, as we all know, the Abuja Declaration, which speaks of 15% allocation for health for all countries in Africa, and which was signed here in Abuja, we've been very far from that. Usually at the federal level, we're only talking about 5%. I mean, in fact, less for the past few years. And in Lagos, we had 8.86% last year. We don't yet know what we're going to have for 2019. So it's a very far cry. And the need is huge. So one of the things we're looking at is that we need to start looking at innovative ways of financing. One is, of course, the health insurance scheme, both at the national levels and at the state levels. And we're very happy that in Lagos State, the Lagos State Health Scheme has also been launched, because this is the kind of, we need to have areas where funds are coming in to ensure that the health sector is supported. We're not going to be able to achieve any of the plans, the Health Action Plan, Health Security Plan, or the Greater National Health Strategic Development Plan, so if there's not a radical change in the status quo with regards to health investment. Okay. So we're looking at that more.
Okay. The single biggest cost component of the budget is immunization and some other health sectors like emergency preparedness, public health threats, and all that, with zero allocation to family planning and primary health care. Is this the way to go?
Well, naturally, since the action plan, the specific action plan is on health security, which deals with prevention of infectious diseases, it can be expected, as it is now, that 60% of the budget expected will be on immunization to prevent infection. In other budgetary documents and plans, you'll see more importance of family planning. And of course, federal government has already committed, as part of its commitments towards 2020, to give $4 million on family planning communities every year. which they've started doing.
Recently, the world commemorated the Universal Health Coverage Day. Is there any correlation between this day and the National Action Plan for the Health Security recently launched?
Absolutely. Of course, universal health coverage envisions where every citizen has access to affordable, efficient, and quality healthcare services. And of course, this National Action Plan is one of those interventions on health security that will ensure that that happens. And if we look at all the indicators now, we'll see that with the overriding the larger national strategic, second national strategic health development plan, we have targets which we could move to attain the universal health coverage. And so these are one of the interventions, the health security plan. But as we said, it needs a lot of investment to make sure it happens. We're talking of, in the health security plan of 134 billion, they have to be funded from somewhere. And so from our point of view, universal coverage is not just going to happen by itself. It's going to need investment in that sector, and this is what we've been advocating for.
What are your expectations at the end of the 5-year plan?
The expectations of everybody is at the end of the 5-year plan, Nigeria will be completely prepared for any emergency with regards to infectious diseases. We're not going to have to depend on anybody from Washington or London or wherever before we can actually respond to diseases. And as I said earlier, the aspect of infectious disease is still very much with us. One of the largest outbreaks of Ebola is happening right now in DRC Congo. So we have to really realize that we are on the front line in Nigeria as one of the largest country in Africa and one of the most widely traveled peoples in the globe, that we really have to be prepared. And this is a step in that direction. But it's not going to happen by itself. It's going to need the investment from the key stakeholders from now to make sure we get there. Because we should remember that it's a 5-year plan. It's 2018 to 2022. We're already in 2019. So already 1+ years is gone. What have we done? That's the question. So we have to look at the 2018 budget. Was there anything in the 2018 federal budget, state budgets, that is keying into this? Is there anything in the 2019 budget that is keying into this? What are we doing to ensure that the private sector is buying into this and they're actually funding it? Many of these big health schools, Harvard School of Public Health abroad, many of them are funded seriously by the private sector there, endowments and all. So our private sector here, big men, we have some of the richest men in Africa, in Nigeria, they should be encouraged to begin to set up endowments to fund this kind of interventions, the health security plan. Instead of us waiting for foundations from abroad, we can start doing it here. I mean, if we count the number of private jets that we have at the line at the tarmac here, owned by Nigerians, we should be able to start doing things like that. But they won't do that unless there's that enabling environment for them to be sure that, yes, the funds will be utilized. And I think that's where government needs to come in. Wherever they can't fund, private sector should come in. Before we now start thinking of development partners. Development partners should be last. Things like health security must be our own baby. We must own it as a people.
Do you see the country achieving this plan?
It's achievable. However, it needs investment. The plan will not just achieve itself. And that's why we've recommended before that we have to think of innovative ways of funding. One is, of course, increased government funding. And two is even ensuring that there is now contribution from all beneficiaries, citizens. And that's why it's been recommended that we should look at a health mobile phone tax of just 1 kobo per second. And if we think about the number of subscribers we have, registered with the NCC, talking of 165 million. If each one spends about an average of 10 minutes, of course we know many people spend hours on the phone, just 1 kobo per second would give us more than 350 billion a year, conservative figure, just for our health. So that takes care of this. That takes care of a lot of issues with our basic healthcare provision fund, universal health coverage, etc. That is one way we can kickstart, catapult this health sector to where we want it to be by 2022. It's not going to happen if we just keep the status quo going. And from all indications, especially this year, status quo may even go down because we're all preoccupied with elections for months, and we're not going to get anything done. So we may not even have as much as we did last year with regards to health interventions, in the government sector. So this is one innovative way we are proposing that we should look at to be, and it's doable. This funding, technology, it can do it, and immediately that shows we have universal contribution, and which will ensure universal coverage of health.
Okay, as we round up this segment, what is your final word to key stakeholders in Nigeria's health sector?
The main message is funding, funding, and funding. There's nothing we're going to do if we don't pay for it. The health sector is not going to pay for itself. And so all of us must get together to ensure that we have increased funding from the federal, state, local governments to ensure that our health is actually prioritized. We ensure that we bring in the private sector. We have the Basic Healthcare Provision Fund, which is a legally authorized fund which can bring in private sector funding and other development partners' donations, and on 1% CRF from the federal. We also have in the states, like in Lagos, we have the Lagos State Health Scheme Fund, which has a similar fund to the Basic Healthcare Provision Fund, which would has access from the private sector can be made available. So if we can fund our National Strategic Health Development Plan and the Health Security Action Plan, we can implement, we should start to implement after funding, and ensure utilization, proper utilization, so that funds are not used for things which will not speak to the key health outcomes, which means we need to have a robust monitoring and evaluation framework for this whole health sector plan. Then we can get to where we're going by 2022.
All right, thank you so much, Ayo Adebuseye, for sharing your perspective on the recently developed National Action Plan for Health Security in Nigeria.
Thank you very much. It's my pleasure, and we hope that at least next year we're not going to be talking about them doing things, that we actually have started doing things. Thank you very much.
Okay, that has been Ayo Adebuseye, Secretary General Nigerian Network of NGOs, giving insight on the recently developed National Action Plan for Health Security in Nigeria. Sound health continues with trending and home essentials. Please stay with us. That ends Sound Health today. Hope you've learned a few things about the National Action Plan for Health Security. For comments and inquiries, please send SMS to 08035826603 or follow us on social media at TelTV Social, #SoundHealth. A sound health is a sound mind. Make healthy living your choice.